to McCall College's Community Conversation on YouTube. McCall College offers specialty higher education to all ages in the West Central Mountains. I'm Dr. Bryan Williams, and I'm pleased to be able to moderate the series talking about mental health. Our series goal is to offer education on mental health problems in our area. We'd like to offer strategies for coping with mental health problems and to offer the local and regional resources for help. We are pleased to announce that we've been sponsored by a grant from Region 4, which is our behavioral health board here in Idaho. We are very pleased tonight in our third of our 4 series to welcome 2 counselors from Central Idaho Counseling, Tracie Jamieson and Ashley McCoy. Welcome.
Thank you.
Thank you.
The title that you've chosen for this seems to be a bit of a challenge, so I'm looking forward to our conversation this week. Coping and helping others with instability, stress, and trauma in a pandemic. Thank you for taking on this challenge. I'm looking forward to this conversation. Let's start with you, Tracie. Give us a bit of your background, would you?
So I'm a licensed professional counselor. I have a degree in psychology and a master's in professional counseling. I live in McCall. I have 10 children, been married 25 years, and I'm excited to work with this community on mental health issues. And
I'm just processing 10 children.
Right.
So thank you for the incredible reality of your work at home, let alone the work you accomplish in our community. So thank you for that. Now, what motivated you to go into counseling?
so I've been a foster parent for 14 years.
Okay.
And I've had 109 children. I ran the Shepherd's Home on and off for 5 years. That's a group home in McCall, Idaho for children that may be misplaced from their homes or in the system for a period of time.
I think that's where we first met, is that you were there and we met in the community, and I was trying to figure out Shepherd's Home, which is a wonderful resource here in our community for those kids up to age 18, I believe.
Yes.
And a wonderful tool for us. So thank you for being a part of that organization as well.
Absolutely.
So thank you. Let's take a moment and learn a little bit about Ashley. Ashley, give us a bit of your background.
So I'm a marriage and family therapist, and I went to school at Sac State and graduated with my master's degree in marriage and family child counseling. Since graduating, I actually had the opportunity to work at the Child Abuse Prevention Council in California and worked with a lot of youth there. Then from there, I went and worked as a military and family life counselor at Fort Polk in Louisiana and worked with a lot of service members and their families. And now I live in McCall and I'm working at Central Idaho Counseling.
Well, welcome.
Thank you.
And that same question, what was the motivation that took you into counseling?
So as a young adult, I kind of struggled with who I was, where I wanted to go in life. And so I ended up seeing a counselor and seeking counseling. And my counselor just gave me some amazing tools and kind of got me on a path that really changed my life. And so that really inspired me to want to help others.
Oh boy, that's appreciated. Thank you. Tracie, what areas of counseling do you enjoy working in, or do you find yourself working in?
Mostly I work with children, teenagers, and their families.
Thank you. Ashley, is yours similar, or do you have a different practice?
Similar. I also love to work with couples and families as well as youth.
Very good. Thank you. And so we'll look forward to those emphases as we move through our conversation tonight. Thank you. The pandemic has not just been an illness where we've had disease. It's also been a mental health struggle for an awful lot of folks. And I think we can all, if we look at ourselves, maybe we can say that all of us have struggled with mental health because of the pandemic. It's so new. It's thrown so many things at us. And so what I'd like to sort of focus in on here is a bit of the influence that the pandemic has had on our community. And so, Tracie, how has the pandemic changed mental health in our region from your perspective?
Well, I feel like all providers are just being flooded with referrals. There's not enough time in the day, time in the week or month. I mean, some people are waiting 3 or 4 weeks before they can get in to see a provider. Some of the treatment centers, I used to be able to call and get somebody in immediately. Now we're hearing there's a waiting list of sometimes 18 patients. So the increase has been dramatic.
My goodness. So the problem is equally dramatic.
Yeah. Lack of services.
Yeah. And these are the people that know they have a problem and already know about the resources and are seeking those resources.
Absolutely.
Can you imagine those that aren't?
Yes.
They don't know.
Yeah, because some of the effects are isolation, hiding from these problems, fear of the unknown. And so they're not even asking for help. So there's a lot of those people as well.
And I think one of the benefits, though, as well, is that there's been a lot more discussion about mental health since the pandemic has, started. So I think in our community, the topic and the discussion of mental health among not only, us as professionals in this field, but community members as well.
Are you sensing that people are sensing that focus? Because May is Mental Health Month. And so what I've been seeing are the posters in my work environment and seeing that this seems to be an important focus. Is there a reason why May is Mental Health Month? Do you sense why it's got that title to it?
I mean, it could have that title because, you've just gone through, especially in McCall, the weather. If you think of all over the world, there's different areas, there's different types of the way people are handling the darkness, the cold, all these different things affect their mental health. And I think, especially in McCall, people, November to February is so hard on them. And now, it snowed 2 days ago. So, I think about this time, people are just really struggling and wanting summer to hit. We want more sunshine. And so maybe that's some of the reasons all over the world that people just are finally ready.
You bet. And so May is a good time.
Yeah.
We get distracted once we get into the summer. We know we're coming out of our cabin fever.
Yeah.
And so May is a wonderful time to talk about it. So I'm really appreciative that we have this chance to fit into the overall national calendar. How has the pandemic, and I'll send this to Ashley first, how has the pandemic changed your counseling practice?
Well, I think in one way is that we have had a huge influx, in clients, but mostly like starting with telehealth, that has become a huge thing in our practice now, so that we can reach people in various areas, especially, when we live in rural communities, it's sometimes tough for people to make it in. And so with the pandemic, telehealth has become, readily available to lots of people.
Is that something you had done in the past, or is this a new feature of your practice?
It is a new feature of my practice.
How are you doing?
It took a little adjusting, it's
Sure.
Definitely different than having the person in your room with you. And so it's taken a lot of, finesse to get it to work in a positive fashion.
And in the teaching environment, when we went to teleeducation, it really changed the way we could teach. And so I'm sensing you might be dealing with an awful lot of changes in trying to discover strategies for working in this medium of cameras and sound and lights and all those different issues.
Right.
And so that's certainly a challenge. And Tracie, how has your practice adjusted?
So similar, we've adjusted by using telehealth if we weren't able to do face-to-face. I work with a lot of children and teenagers, and that was a very difficult change for them. A lot of them I did put in the systems in place, and we were able to do face-to-face. Some of the kids that I wasn't able to do face-to-face with, I would meet with them on telehealth. We would discuss, some of the symptoms that they were having, some of the things. And then I would tell them, okay, I'm going to mail you this project. So you're going to get it in the mail within the next 3 or 4 days. And then next time we meet, we're going to do it together. I'm going to have one and you're going to have one, and let's do it together. So those are some of the things that we did to still be able to do those projects, but not necessarily face-to-face and in the same room.
Did you find that telehealth actually is better in some ways?
I would say the reason it would be better in our area is there's a lot of people that are further out that maybe never sought it before. Yeah. And now they're reaching out and saying, hey, I don't have a car, or I don't have this, or I don't have that. Maybe they don't have internet and now they can use their phone. I mean, there's so many more resources for these people that were not seeking it in the past.
I hope that allows us to grow the availability of counseling to a greater part of our rural and resort areas. I think it helps in the education side. I would hope that we could also help on the counseling side. Let's sort of focus in on the problem that the pandemic has really highlighted in our region. I'm going to use the term uncertainty. I think we all don't know where we're going. And so this train we're all on, and it certainly has left the gate, and we're all on it together in so many ways, but we have no idea where we're going. And so that sense of uncertainty must be fairly universal. I think we all put our masks on whenever we go into a social setting and project confidence in lots of ways. But uncertainty, I think, is a key term. It seems to be such a key problem. How has uncertainty affected those that you counsel? Let's start with Ashley on that one. Yeah.
I mean, I feel like for, lots of teens and youth, like the uncertainty of knowing like their day-to-day of what life is going to look like, right? And so when we think about the uncertainty, like it has really shaken a lot of people to their core. And so like some of the statistics that I'd like to share is that, with this uncertainty, we've seen 1 in 5 youth attempt suicide or think of attempting suicide, and 1 in 10 have attempted suicide. And that's a scary thought. That's, when our core is shaken and there is so much uncertainty with, for youth specifically with school and sports and, just all of these changes that have kind of happened, and nobody knows when we're going back to, so-called normal.
My goodness. So those statistics are frightening.
They are.
And if we assume that there's in the range of 400 of our, just thinking of the high school population,
right?
We've got 400 high schoolers in our region, and if you added Cascade and some of the other aides, you're looking at 40 kids,
right?
Which is an amazing and challenging statistic to work with,
right?
Tracie, uncertainty.
So Kaiser Family Foundation put out a poll in 2020. 45% of adults that they surveyed had quite a bit of an impact because of the pandemic. And I look at, our area where the children and teenagers were lack of interaction, schools were closed, daycares were closed, all the resources that they knew, churches, activities, all were shut down. We can only imagine the parents that had the coping skills, or, more so than the kids, how many of the kids were actually affected. And as we're going back into less restrictions, what are we going to be faced with? These kids are going to be like, what if They're catastrophizing. Everything's got to be the worst. When's this going to happen again? So I think all of those, come into play as things are changing again.
Thank you. Just thinking of the children in my world, it is the uncertainty then seems to move to levels of stress and trauma as we think of this. And how has that worked out in the lives that you're touching? How have young people coped with the stress and trauma that grows from the uncertainty, let alone the disease? And so if the disease strikes their family, now the stress. If the mask mandate creates stress in their family, how are they coping with that? And then on the other side, how are the parents keeping their families safe? And that uncertainty then increases the stress and the trauma in our families and in our social networks. How have you seen your client group deal with the stress and the trauma?
Actually, well, I'll give you some of the cons. So a lot of them that didn't have the coping skills and the necessary resources, went to suicidal ideation. They went to self-harm, isolation, depression, anxiety, catastrophizing, fearing almost everything. And then Ashley has some of the pros, the people that were able to find the resources and have extra.
Ashley, what did you discover?
So some of the pros I felt like for kids and even parents for healthy, coping was, getting out and doing exercise, seeking help, seeking treatment, engaging in family activities, whether that's camping, right? Or now we were able to go to the river and Riggins or, but doing things in a family unit and spending quality time with one another through this uncertainty.
And so stress is a motivator to accomplish something. It's an energy source.
It is.
And so if we can somehow channel that stress in an appropriate way, then there's some positives that certainly come out of this. And so how is our emotional instability affecting us? And so our emotions are really teetering often. And so the uncertainty causing the stress and the trauma, we've all got to try and package this within ourselves. Again, and we've all been isolated. And so now we're coming out, we're discovering things about ourselves. And so how are our emotions handling this? And what are you seeing there? Ashley, on the statement.
I mean, I think in regards to emotions and, everybody being isolated, I think that people have kind of teetered back and forth as we, travel through this uncertain time. Like, at times there are positive emotions. Like, yes, right now, I feel like people are becoming more positive. We are hitting summer as well. The mask mandate, is dropping. Things are getting semi back to normal. So I think that hopefully we will see a bigger shift in more positive emotions. But I think as we have moved through the pandemic, there has been a lot of big, scary emotions for a lot of people.
Sure. Anything else in that emotional management that we all have to figure out?
I think I have seen that roller coaster. They're up for a little bit and they're down for a little bit, and they're just not handling that emotion very well. Some people are completely shut off. Other people are just hypersensitive.
I'm sense I haven't put my finger on enough of the problems. And so I'd sort of like to open it up. What problems should we be getting on the table that this pandemic has caused us? Is there other things that we really should look at?
I mean, I think one of the huge things is that people have become isolated, right? I think if we look at youth, especially since they're at such a, formidable stage, we shut down their schools, right? And a lot of times that is their outlets, to connect, to to belong, to have a sense of purpose. And we let them back into school, but then, half of their faces were covered. So you can't really see, people's facial expressions and their emotions, which has been, a real huge struggle for a lot of youth. And so with that, with the isolation and, the lack of connection, I feel like we've had a huge increase in youth that have become suicidal, that have that ideation, that are, struggling immensely with, who am I? Where am I headed? Where is my life going?
Important. Let's just make sure we've got our problems organized. Is there any other, Tracie, that has come to mind that
drug and alcohol, I feel like, has really impacted during this time. People are just struggling so much that they want to numb, and they don't realize as soon as they stop, it comes right back. And so they have really gone into a deep depression, and they're feeling those same thoughts Ashley just mentioned, suicide, anxiety, high anxiety right now in people.
Excellent. Thank you. I think we've highlighted why we really need a strong counseling core. We really need folks that'll come in. But again, we need the entire village to be functioning well. And now that we're coming back, I think the entire village now needs to be, first of all, aware of this problem, and now need tools to really begin to deal with some of the issues that I think we're all sensing, and you're keenly putting your finger on the problem. So I think it would be wonderful today if you could sort of teach us all, what kind of strategies do you use that you help offer to people so life can get better for them? Let me stay with Tracie on that one. Where do you go when you encounter this?
Some of the strategies, I know we're going to talk a little bit more about cognitive behavioral therapy, teaching people how to change their thought patterns, their negative thoughts to positive, processing what their needs are, and different ways of helping them regain control of their life and focus on positive, more beneficial things in their life.
Thank you. And Ashley, what strategies do you like to use?
The one that comes to my mind would be like looking at Maslow's hierarchy of needs and looking at how, Maslow's hierarchy is based on motivation, right? Like getting people motivated based on where they're at. And so to move them up the triangle, their psychological needs need to be met, which is like their housing, food, air. And with the pandemic, some of that has been shaken for some people. And so making sure that they have that. The next thing would be their safety needs, right? And making sure they feel safe and secure, which also through the pandemic has been shook for a lot of families and teens. And then the love and belonging. And if we look at that, through the pandemic as well, is that we've all been isolated. So that sense of connection, has kind of been taken away as well. And so those are all like, the three basic, modules of the needs that we need to make sure those needs are met for our youth, for our families, so that they can grow and, be healthy individuals.
And so the triangle, I assume that you have to do some assessment to find where they are on the triangle, and then give them those tools to move them up. Right. It's a wonderful tool in giving them a goal, but giving them steps that they can move towards some important goals in all of our lives.
Right. And every client that comes into us, we do a comprehensive diagnostic assessment and a treatment plan for them based on their needs and where they're at. And it's very important to always meet a client, at their level. So their goals should be for them and what they need, not what the counselor feels that they need.
And so is that one of your primary strategies that you use often?
Yes. I mean, for every client, we do a CDA and a treatment plan. And for every client, I 100% try to meet them where they're at and their needs.
Now you used initials. We do a CB.
A CDA. It's the Comprehensive Diagnostic Assessment.
Okay. So all of your clients get a diagnostic assessment.
Right.
And then you begin to use your various strategies and tools,
right,
to assist them on that.
Mm-hmm.
And so, excellent. And what are your primary techniques, Tracie, that you enjoy using?
I use very similar ones. We do the CDA and a treatment plan. Okay. We determine where they're at, what would be the most beneficial. I do also integrate like diet, exercise, some of those things, because I do feel like that is very important for every person.
Very good. Yeah, that's got to be something that hasn't done well either in the pandemic. Yeah. Exercise, thank goodness now we've got a bit more of that today.
More available than in the past, for sure.
So that's important. So how do you judge success? Let me stay with Tracie on this one. How do you judge your success in your work with each of your individuals?
So when they first come in, we also do a biopsychosocial. Sometimes we'll do a PHQ-9. That is an assessment to check like for mood and how they're feeling about themselves. A Beck depression inventory or a Beck anxiety scale. Those all give us kind of where they're at right now. And then in 90 days, we'll do a 90-day review. That'll give us, okay, where's our progress? Where's our downfalls? Sure. And how do we maybe change their treatment plan a little bit? Sometimes when you do the assessment at the very beginning, they may just barely be talking to you and you might not have that trust. So, a couple months into it, we might have a lot more information, maybe the trauma they've been under, more presenting problems. And then we do need to change the treatment plan a little bit. So we're able to go back in and kind of adjust.
That sounds like a lot of good data. If people will give you that data, that seems to be a wonderful baseline that you can work from and allow you to really know if you're successful. Do you use these in other settings, such as the courts? Is it that kind of data that you can use it in other professional settings?
Absolutely. I just had another clinician call me the other day and they're working with a case through the courts. And he says, what are the most effective? What have you noticed evaluating after a 90-day period and actually seeing a major improvement or not an improvement at all? And, those were the ones that we had suggested using through the courts.
Very good. So this sounds fairly hard in the way that you can offer people advice that is very much your spoken advice, but equally there's some real data here that people can discover about themselves and how they're changing and adjusting. Thank you. Ashley, how do you sort of judge your success in the work that you're doing?
Right. I mean, and the same with Tracie, using a lot of the same assessments. Another one that I like to use is the Leicard Scale. So, on a scale of 1 to 10, I'll ask my clients, how are you feeling and how have you felt this week? And kind of, track their own personal, how they've been feeling in their scale on a 1 to 10 scale.
Yeah, those would be really helpful. I think there's a challenge sometimes in that we know in our lives that sometimes things don't go as we planned. And I'm sure your files are filled with plans, but sometimes those plans might not go where you had hoped. How do you sort of handle that when your successes aren't as successful as you'd hoped? And where do you go with that, Tracie?
So I think after we do the review, we realize, okay, this person has gained some progress or they have not. Maybe they're more, their suicidal ideations are more often or daily or hourly. So as we're evaluating that, we might go, they need a higher level of care. they need to be sent to St. Luke's for additional assessment. So if they're harmed to themselves or somebody else, we send them to St. Luke's. They evaluate them. I usually have very close contact with them, and we might send them to a treatment center, maybe in Boise, Coeur d'Alene, or Idaho Falls.
Okay. And is that similar to your?
Right. And I think it's, if we're not having, good forward progress with clients, it's really reevaluating and seeing, do they need higher level of care? Do they need more support, right? Do they need more community support? Like, where is, the challenge? Like, what's happening where they're not moving forward?
Okay. I think one of the strengths of this medium is we can sort of talk to people. And I sort of give you that opportunity now. So if someone came in with anxiety or trauma or uncertainty or ideation, I'd encourage you to sort of pick one of those. And what would you say to a person that presented with that? What would that early experience be like with a client? Could you sort of walk us through one of those problems and sort of give us some help, or open the door for people that might wonder what would happen if they came to see you?
I think for me, like if I had a client that came in to see me and was having thoughts of suicide, one of the first things that I want to do is build a relationship with that client, because the more trust you have, the better off, the more open people will be, right? And many times, like, the most important thing in a client counselor session is the relationship. And so building that relationship, but also if they're coming in with suicidal ideation, creating a safety plan with them, right? Giving them the resources, finding support people that they can actually count on, and just various community resources, as well as their own internal kind of coping skills in that safety plan. And
so walk us through would that be first a lot of talking the first time they meet you? It sounds like there's a lot of data here. When does the data get presented, or is there is there just too much flexibility in this? You really can't put a handle on it. But what might be happening in their lives that helps you to know where that problem is and where you can help? Is there?
Well, I mean, I think, we collect a lot of the intake paperwork, where there's a huge packet, with a lot of the assessments that we have them kind of fill out, usually hopefully prior to the first session, so we can kind of get that information ahead of time, and then meeting with the client. Oftentimes, the first time I meet with a client, I like to kind of do a timeline of their life, so I can get, important events that have kind of changed them or changed their path in the direction that they've been headed, and that they feel like are important pieces to who they are.
Now there's maybe I'll come back to Tracie and say, pick one of those key issues that we've been working on tonight. And if someone presents to you, give us sort of a pathway that you would like to carry them through to begin to understand the problem and find a pathway that'll carry them out of it.
I think if somebody comes in with anxiety, we might talk about, do you know where that's coming from? What has triggered you? Is it school? Is it home environment? Is it your job? Is it something that happened in the past? So we're not leading them, but we're giving them things that could potentially cause this increase of anxiety. Once they're able to tell us, which could be that day, or it could be 2 days, 3 sessions, up to 2 months sometimes. And once they finally have that trust in us, they might say, man, my environment at home just isn't quite what I expected. I don't know how to handle this conflict, or I don't know how to handle this. And so we kind of walk them through that. give them the coping skills that they need. There's many types of coping skills. There's mindfulness techniques, relaxation techniques, meditation. So all of those things will help start seeing progress in these people.
Right. And I think some of the other techniques too that Tracie and I have also both incorporated are like grounding techniques, which is a great one where you can bring yourself back into the room and out of your mind if you're, struggling with being stuck in your head and anxiety, where you run through your senses. Another great technique is tapping. And so I think all of these sorts of techniques have been.
Oh, I've got to know more about this one. Tapping. What would be the problem you're working with, and how would this work in a client's life? What would tapping be?
So it's a way to kind of emotionally let your body know that it is safe. Okay. And so there are different points on the body where you can tap and you say to yourself, that you are safe, that you're, yes. And so it's a really great tool that you can kind of use in the moment if you need to.
Okay. And so if someone is watching this tonight, and is there something you could give them? Is there a place that they could tap that would make life a little better?
Absolutely.
What would that be?
So what I would probably recommend is on your phone, there's an app. It's called the Tapping Solution.
Okay.
You can go on there. There's a few that are free. You can also subscribe.
Sure.
It's like $12.99. And it actually walks you through the process. So it will talk to you and show you the exact locations that will help you.
Isn't that wonderful? So they could carry it around with them, this tool.
Absolutely.
And we'll come back to more resources, but I'm just so intrigued with this one that it really might be something that is always with them, if that were valued. Thank you. One of the challenges, I think, is both of your practices are dealing with young people and children. And that means there's a parent there. How do you handle that challenge when the parent is certainly available or there or with them? How do you sort of negotiate those issues that come from a child and a parent, a child or a young person and their parent, and the reality that could be an underlying problem? How do you sort of get through that?
I mean, oftentimes it's important to, provide parents with what I would call like psychoeducation, on different mental health, on different coping skills. Oftentimes I will draw on a whiteboard for a parent, like a picture of a puzzle. And I say, you can hand me one piece of the puzzle and I can round it and form it. But the moment I put it back to the puzzle, it's going to form back to its shape. And so if you think of the kid as a puzzle piece, like we can take them out and round them out, but then we put them back into the environment and they're going to form back into the puzzle.
Is there a strategy for dealing with that? I think you've clearly laid out what happens when you pull kids out and put them back in. And so would that be conversations with the parent or the child that after you've alerted them to that problem, that you can move them in some direction?
Right. And I think that's, mostly through providing them with, either psychoeducation or resources for themselves, depending on what's going on and what's kind of happening in that family.
Okay. Well, we're clearly in need of resources. And if there's something that we always wonder about is, do we have what we need in a rural resort setting here in the middle of Idaho? And I think we all worry about resources. And so what resources have you encountered that are helpful that people should be aware of? And sort of give us your list that you think is valuable. I'll come back to Tracie here on that one to start us.
So the resources that we have available, a lot of the techniques that we use, I feel like, going back to the cognitive behavioral therapy that we talked about earlier, there are so many interventions that we use. One is the cognitive triangle. It kind of shows people your thoughts add to your behaviors, and your behaviors feed your feelings. So if you wake up in the morning and you have really good thoughts, you're probably going to accomplish more. And then at the end of the day, you're going to feel really good about yourself. Now, if you wake up in the morning and you feel negative and not so good, you might not accomplish as much. Your actions or your behaviors might be a little more negative, and then you're going to feel worse about yourself at the end of the day. And I think that's something that's important, not only for the child, but for the adult. So we might wake up in the morning and, it's raining. Oh, okay, guys, go get ready. And we're already feeding them the negative rather than going, wait a minute, I got to remember what they taught me. I got to go to that triangle. Okay, my thoughts need to be good. Okay, today's going to be a good day, even if that's not really how we're feeling. So being able to change our thoughts, flip them from negative to positive, so we can have positive thoughts, positive behaviors, and feel really good about ourselves.
So I'm sensing a really good resource might be to get a copy of these two triangles. The one on Maslow's hierarchy and the other on the cognitive behaviors. And just give yourself those tools to remind you that
absolutely
there's a pathway here that you can follow and increase. So maybe that's a first really good suggestion is print out a copy of these and have them available until they become intrinsic to who you are. Excellent. What other resources can we start thinking about for people in our area? Ashley?
I mean, we do have the St. Luke's Behavioral Health. We have Central Idaho Counseling, which we offer, an array of services from case management, CBRS workers. We also have the counselors, and then we also have our drug and alcohol program through Central Idaho Counseling. We also have Deb Jensen, who is an art therapist here in McCall, Jen Capel, who's in private practice. So we have some great resources there. There are also The Rock, which is now here in McCall. And some online support resources would be like, there's a text suicide line, which is 741-741. And you can text him if you're having suicidal ideations. There's also another great website called bethere.org. And it's just a great resources for peers and parents on, how to talk to your kids or how to talk to your peers about if you see someone struggling, like how to take that step.
Thank you, Tracie. Is there other resources that you're sensing we need to be aware of?
I know there's Jamie's Place. That's for young women that are pregnant or have, experienced some sort of loss. I do feel like that's a great resource as well. We have our churches, we have our schools. There's, so many resources that sometimes we don't even think about that are out there that we can, get no matter what.
If we don't have something here, and I'm sort of thinking of a parent in an emergency, and their child is really struggling, and clearly different than it is the normal child, and they're dealing with something. Where would you send them? What and then when you send them somewhere, what can they expect is going to be the journey of recovering their mental health?
I think St. Luke's in our area is the best option.
Okay.
If you just are not sure how to handle something and you can't get a hold of somebody, you take your kid straight to St. Luke's and McCall. They're able to evaluate, is it a medical problem or is it a mental health problem? And once they determine if it's mental health or medical, then they're going to put you on two different paths. If it's medical, they're going to take care of that. If it's mental health, they've got workers there. They've got 24-hour social workers. Then they evaluate where the child is. They might, like Ashley mentioned earlier, put a safety plan together or a treatment plan. They might refer them to a counselor in the area, depending on the severity. If it's real severe, that's when they would call maybe Cottonwood or St. Al's Behavioral Health in Boise. They take kids 12 and under. Cottonwood takes kids 13 and older.
Okay.
So those are some resources for families that are just, they're not sure what to do. Take them to the closest emergency room and they can be evaluated. Because
we don't have what would be called a psychiatric unit in McCall, which means the more challenging cases that do require a medical intervention, we're going to have to find resources outside of our region. Is that correct?
Yeah. So when we send a client to St. Luke's, for example, they would evaluate them. Let's say they say, you know what, you're at high risk of suicide. They're going to say, you know what, we're going to call some of these other facilities, Cottonwoods and Meridian. There's Intermountain in Boise, and there's St. Al's Behavioral Health in Boise. And they're going to say, okay, because the child is at such high risk, we're going to call a company called Peak. And they're a transfer, almost kind of like an ambulance, but it's a car. And they put the kid in there safely and they take them down there for you. So they're the transport.
So that's all organized.
Absolutely.
So if you need resources outside of our community, there is a plan in place to make sure that this can happen.
Absolutely.
Safely and to the benefit of the family. That's so important. Thank you. What financial resources are required for help in our region? And Ashley, what's your sense of how, because we all sort of assume this is going to be expensive.
Right.
What's the financial resources we have available?
Well, through Central Idaho Counseling, we do have a community medical fund where you are offered 6 free sessions of counseling through this fund. There's also Medicaid. If you are low income, you can get on Medicaid, which Medicaid will cover mental health services. Also, if you don't have any insurance, you can also start with a school counselor, go to your pastor at the church. There are some options and avenues to get help.
Thank you. We'll let you get a drink.
Thank you.
And Tracie, jump in and help us with this financial trio, this financial challenge.
Absolutely. So there's a fee scale at Central Idaho Counseling and at most other counseling centers where you kind of go by your income. So the less income you have, the less you pay. The more income you have, the more you pay. And so that is also an option for people. But also St. Luke's does have a financial department where you can go in and talk to them and get additional resources that may not be in this area, but people in rural areas can use.
Okay, so this is new to me. I had assumed you guys work on a dollar. I'm going to have to pay X number of dollars because you're a professional, and the number of hours I'm sitting there, I've got to pay that. I went to my mechanic today, and I was quite surprised with the dollar hourly amount that I'm now paying for my mechanic.
Absolutely.
I was surprised, and so it's not a set fee, is what you're saying, and I think we really need to settle in on this. So help us. How would you discover what would be the right fee for me?
So let's say if you made $70,000 a year, you're probably going to be paying $70 or $80 an hour. Okay. Let's say you don't have an income, and you don't have insurance. We might help you get on Medicaid.
Okay.
Or if maybe you have an insurance, but your copay is $50 and you just can't afford that. We'll work with you on different resources to make sure that you can have the service that you need.
This is amazing and appreciated so that people can access. And so let's sort of begin to work people through. What would be almost or free for someone if they needed help? Is there free that is available to them?
Yes. So the Community Medical Fund will pay 100% of your cost of counseling for 6 sessions.
Okay. And that's everybody.
Anybody that qualifies for that program.
Sure.
Now, Medicaid, same thing. If you qualify, your income limits qualify, Medicaid pays 100% of your mental health care.
For how long?
It depends on your circumstances.
Okay.
They will evaluate and look at, the progress and all of that data that we talked about earlier.
Okay, and you mentioned the churches. What role would the churches be at this stage of trying to access help and not having a lot of money?
Well, I think the pastors, they are willing to work with people that are in their congregations. And if the people are willing to say, hey, we've got this problem, they'll talk to them. And, I've had quite a few referrals from some of the churches. And what they're saying is, we worked with these people 3 or 4 times. We're realizing that the problem is just a little bit above our heads. Here's the situation, and they kind of pass them off on to us. Some of the churches are so generous that if the people don't have the resources, the churches are actually helping.
Okay.
So that I think that's another resource. Same with the schools. These kids don't even realize that they can go and talk to their school counselors and give them the information.
Nice.
If there is a situation where the school counselor feels they need a weekly counselor, then they send us the referral and we work with them. Even if they don't have the financial resource, then we'll find a way to get it to them.
That's exciting. I mean, does this work? I sort of put you guys in the modest categories as far as fees and expense. But what about the psychiatrists? These are how in the world do people afford that if you need to go to that medical community for help? Is the help there for them as well? This isn't your
right.
Your bailiwick.
That's what I was going to say.
Okay.
I have worked with. I did my internship with the psychiatry center in Boise,
okay.
And I feel like they have a very similar process that we do. They have a sliding scale. They will help their people get on Medicaid. There's many resources in Boise. I want to say Salvation Army. I know there's another one. I can't remember off the top of my head, that all are willing to help because they know mental health is so important. Some of them have funding for medication management and different types of programs as well.
So the really good news is, no matter where your need is, there are resources that will help you.
Absolutely.
And I think that's what we really want to state as clearly as we can. Thank you. And you're clearly a part of that help, and our community is so appreciative. Is there anything we've missed in our conversation that is important that you want to make sure that folks watching tonight will have a chance to hear about? Have we missed anything?
I think just that the takeaway is if you need help, reach out. The text hotline for suicide is 741-741. There is help out there.
That sounds different than what I've encountered. But what was that number you used again? 741-741. And it's just a text hotline for. Oh, that's a text number. Mm-hmm. That's not a telephone number.
Just a text.
So if you put in 6 digits into your phone, what's going to happen?
If you text them, there are people on the other side that will respond back to you and get you, be either a support person for you and kind of talk you through.
Is that for any particular problem, or is that for one problem?
It's for suicide ideation mostly, but you could, if you were feeling isolated or lonely, you could probably reach out and they would probably be there.
A great one.
And they did that because teens like to text and not call anymore.
Yeah. Excellent. Tracie, have we missed anything that you want to make sure we talk about?
No, I just do want to, reiterate that it is so important to seek the help that you need. Don't feel like there isn't a way for you to pay for it, or don't feel embarrassed, because every person that has come across COVID, which is the whole world, they have all been affected. It doesn't matter where you live, what your income status is. Every single person has been affected. And I would tell you that I'm shocked at how many people have already reached out for that support, saying, hey, you know what, we need more coping skills. We need more interventions to show us how to deal day to day we're going back to our jobs and we're so stressed out about what if this happens again, or what if, so I'm saying to anybody out there that needs this help to call and find, whether it's St. Luke's or Central Idaho Counseling or Deb Jensen, Jen Capel, we're here for you. We want you to have the resources that you need. We want to be able to find out what is causing your issues and be able to help you have a more successful life.
Oh, that's wonderful. Ashley, any final wrap-up thoughts that you just want people to know?
No, just, reach out if you need help.
Oh, that's important. Thank you. It has been a joy to talk to you today. You folks are involved in such important areas of our community. And those folks that you've had a chance to interact with, and you sense the value that you've been offering to people. But this is a chance for us to get a real sense of what you two, let alone all of the counselors within our community, and what they're doing daily to try and make our community better. And so may I offer you our thanks for the hard work that you're doing to pull us out of what this pandemic has done. And so thank you.
Well, and I want to thank you for bringing this to our community and other communities, the awareness that there is a severe problem with mental health resources and with mental health in general. And I think the more the awareness is out there, the more people will go, okay, counseling and therapy is normal. That's how these other people are managing. I need to do that too.
And just to speak personally, when I talked to Katie last week, I admitted that I'd never seen a counselor. Now, I've had situations where people have indicated I should,
right?
But I've never done it. And so for me, this is important. And I think the boomers, my group, probably is a little slow on the uptake when it comes to counseling. And possibly our kids are a little quicker, and maybe our grandkids will do it just as part of life. But right now, if I were to say anything, it's those in my age bracket. Counseling's there. Counseling's valuable, and you can find a better pathway by going down it. So thank you again. Wow, this has been helpful, and thank you for watching tonight. This is our third lecture, and so next week we will have our fourth lecture, and we're pleased to be able to introduce to you what they said quickly was the Rock. And the Rock is a new resource we've got here in McCall. And what it means is recovery-oriented community. And we're going to have a sense of what this new community in our community is doing. And so I really look forward to introducing you to the folks at the Rock. We hope that we'll see you next Thursday at 7 p.m. for our next community conversation on YouTube.